the to-go program is a really great package of services and support for busy primary care physicians in which they can improve their office staff function, where they can greatly improve their care that they're giving to patients, and really provide the excellent level of care they've always wanted to provide in an environment today that is more challenging than ever. So we offer our participating physicians the opportunity to, yes, get your certification done, but really go beyond that. And at the end of our program, have something that's sustainable, that really will continue to make a difference for patients, and will be a lasting benefit for the practice. Well, recertification can be a real challenge. Oftentimes it's an individual-based program, there are not very many resources, and at the end of the recertification process, many physicians said they really didn't have anything that was sustainable. So we offer the opportunity for physicians to get that recertification completed, finished. So there's the offer of recertification, which is an easy mark. We can really help docs get that done very easily. But in addition, we allow them to, at the end of the program, have something that's really sustainable and which they can continue to improve and enhance their care with. Many of the physicians that we worked with in the COPD program realized that they were able to pick up new patients who were previously undiagnosed, give them the appropriate treatment, but identify a number of additional patients who really benefited from specialty referral. And they could also make those referrals much more efficiently and much better, and they were much better prepared for that visit. We know there are evidence-based interventions that really help patients, but it's often a challenge for the individual physician to implement those. So our IMPACT and to-go programs on asthma and COPD provided physicians with the tools they needed to provide good care for asthma, to empower their staff, and to ramp up their skill level so they can do more for the patient in the office. And we also allow them to get extra training to provide services such as spirometry and better formal asthma education and COPD education. One of the major areas of importance in both asthma and COPD is spirometry. And we know that that's underutilized in primary care. So in the to-go and IMPACT programs, we were able to obtain some better access to spirometers for our participating physicians and help them access some really superb training programs in spirometry for their staff. So their staff could really become very, very well trained in spirometry and allow that service to be provided in the office for their patients. The results of each program have been excellent, and we've been so impressed with the ability of physicians to take the tools we've offered, come up with their own initiatives, and really succeed in the ways that really make a difference to them and their patients. It's been great to see physicians who might be initially struggling or have goals for what they want to do but haven't been able to do those yet and accomplish those, to use the resources of the to-go and IMPACT programs and really ramp up their level of care. In the cardiovascular to-go program, we were able to show improvements in all the major parameters in cardiovascular care, including blood pressure, cholesterol, exercise, smoking cessation. In addition, we saw that the practices really narrowed their variation and got not only improved their care, but got close to the same page in terms of the consistency with which they were able to provide good quality care for heart disease. In asthma and COPD, there were marked improvements in how well they were able to achieve adherence to national guidelines, to do spirometry, for example, to provide their patients with inhaled steroids for appropriate patients, and to be able to use control assessment and action plans. We know that, for example, action plans for patients with moderate to severe persistent asthma reduce the risk for death and serious complications by about 70%. So providing that within the primary care physician's office can be very powerful. It's satisfying to see my colleagues be able to give the kind of care they want to give, to use their staff the way they want to be able to do some of the extra things for patients that they've always wanted to do, but haven't been able to leverage resources to do it. I know that it can get lonely out in the front lines. I know it can be challenging in the front lines because I'm a practicing physician myself. And I know that I have a great, hardworking staff that wants to do the very best we can. So the more we can allow physicians to provide the level of care that they really want to provide and to use the great staff they have in new and more enhanced ways, that's just a win overall.